Hello again, and welcome back to another episode of Mondays on Mondays. This is the CDH Dad and
the CDH Warrior.
And welcome to the start of a new day, or a new week. Just as a general introduction, we are last name Monday, hence the Mondays, and we put this out on Mondays. The focus of what we do is try and provide a forum to discuss issues related to families that have children that have special medical needs and some of the life experience that goes through there. We don't try and go through all of the medical issues or the new technologies or what capabilities are, prognosis, things like that. We basically provide the disclaimer that we are not medical professionals. We're not therapists, we're not nurses, we're not social workers or anything along those lines. But we are a family that for almost 3 decades have had to deal with 2 children with 2 totally diverse medical conditions, both very unique. The CDH, my son, was a congenital diaphragmatic hernia survivor and has had 2 repairs and bowel resection and multiple other issues with that in his early ages, and then we had to go through all of the early life experiences from that. We've been very fortunate that his health has been in extremely good through these times. There are some issues that will be problematic as he ages, but we'll deal with those. With my daughter, who was born 2 years later, there was nothing in terms of a birth issue or a physical ailment from that standpoint. But when she was about 1.5 years old, she developed a condition called aplastic anemia, which involves the bone marrow, hers essentially totally shut down. And we could not use the standard treatments to
go back to normal.
To get that back to normal and deal with that. So she ended up having to go through a bone marrow transplant. And we went through all of the issues related to that, and then related to the complications post that, which relate to graft versus host disease. And we're also keeping an eye on other issues because there could be recurrence. There can also be cancers related to the chemotherapy and the radiation that she developed and other points from there. But again, I have another healthy child, so...
Let's just say, and added to that, they haven't grown any, that she has cataracts from it.
She has cataracts from that, which a lot of times happens when you have total radiation, as she did at that young age. So those are a lot of things that we have to deal with over the long term, that we like to just be able to open the forum and discuss those within this group. So at that point, let me just say, we pick up topics from what we see on social media, what we get in contact. You'll actually see a email address that will show up in this broadcast. So if you have any comments or questions, you can do that. But the topic we have today is related to a recent news story that occurred many years ago, and we'll go into that. We'll call it Munchausen by Proxy because that's the better known name at this time. It actually has a different nomenclature now, and the psychological issues with parents or family members that have children that they falsely place health issues on that child. So we will get into that in just a little bit, but at that point, I'll turn it over.
Let's roll the title.
Hello, and welcome back after the brief introduction and titles and all those things. But as I was discussing, part of what I wanted to discuss today is related to a condition that's been called Munchausen by proxy for quite some time.
Yeah.
But it is a psychological disorder usually attributed to a parent.
Generally, it's a parent or caregiver.
A parent or a caregiver that, for whatever reason, they contend that the child has diseases, abnormalities, whatever those issues may be, that they don't necessarily have.
Yeah.
And the reason I wanted to bring it up within this group is there are some times that as a parent with a child that has serious health defects and serious health issues, we sometimes look at it, and I've brought this up in previous broadcasts of what we call, when you hear the hoofbeats, you look for zebras. And particularly, I know in our case, because of having two children with some of these unique situations, you many times look for the most dire conditions first,
Yeah.
and want the doctors to deal with those rather than what would be the normal abnormalities.
Yeah.
And part of the reason we kind of go into that is, I know in my son's case there were several issues that surprised us. He had a hole in his diaphragm that was repaired, but then that repair failed, unbeknownst in between the doctors. We'd gone to different hospitals and those type of things. And then while still in the hospital, we found that there had been damage to his GI tract, and there was leakage there, so there were things to deal with. So a lot of times there are things that come up that the parents and the doctors have to identify that are not part of the standard expected protocols in some of these things.
Yeah.
And then there are issues that come up. I know you had seizure disorders and some other things that were not expected, but did develop, and we're not quite sure why.
Although, jumping on that, it is actually shown that it's, especially in rare disorders like CDH, Aaron's aplastic anemia, things like that. Aplastic anemia itself isn't rare, but in a child that young is rare. It's noted that there are some neurologic abnormalities tied to that, tied to some of the issues that we've been through.
It is. In a lot of cases, I mean, part of the reason we kind of bring this up within this group is that when my son was CDH and was in treatment, there was a 30 to 50% chance of survival. Now it's an 80, 90% chance of survival in most cases. So with that being there, there are not a lot of subjects to study and to see the details over time of what develops there. The same with aplastic anemia is the treatment many times, if the standard drug therapy treatment does not help reboot the bone marrow and the blood system, then it's on a very short timeline to be able to find a suitable donor and do a bone marrow stem cell transplant for that.
In cases like that, you're talking 10%, 15% chance of survival unless you can find a donor.
It's about a 15% chance of survival unless you find a suitable donor. And in many cases, it's difficult to find a donor. So these are the type of things that we deal with and discuss. In my daughter's case, it was what occurred was she had what was a typical childhood ear infection. And aftermath, we determined it was most likely a rotavirus. And many times a rotavirus can cause other complications, and it is a key contributor to children that have aplastic anemia. And that's being developed really in the last 25 years. They've gotten more data to attribute to that.
I remember when I was a teenager, they were discussing rotavirus. because it became widely studied. There were public service announcements all over the place about it.
Right.
But most people don't consider all the damage that you can have after the fact. They don't consider the aftermath.
Right. A lot of childhood diseases we don't think about the reason that we have a lot of the vaccines and the childhood treatments that we have now to prevent some of these illnesses is because, yes, a chicken pox or a virus or something like that, seem pretty benign in general, but they do have the potential to cause some catastrophic illnesses.
Yeah.
And that's the case with rotavirus and aplastic anemia.
Yeah.
So it's one that, now that we're getting to where we have a much better survival rate in some of those and much better treatment rate, we're able to look now a little further ahead to see, okay, what else can be attributed, what else can be a problem. But part of the reason I'm bringing that up is in my daughter's case, it was when she had the ear infection, and then she had some bruising issues that occurred. She had already been to the doctor. The doctor said she probably just has a childhood virus. We'll go through the standard treatments. Then she had the bruising. My wife took her back to the doctor. The doctor said, okay, well, we'll need to do a blood test and see if we can determine just exactly what's going on. And before we could get the results from the blood test, which was just a couple of days, her condition deteriorated and got much more severe. She was having difficulty moving, walking. You could tell she was not comfortable. The bruising was worse. And this was on a weekend, so it was difficult to find a doctor available.
Yeah.
We were fortunate in the fact that our neighbor was a pediatrician and at that point in time was responsible for the regional health department. And when she saw my daughter on Saturday, she says, I will be at the emergency room tomorrow working on the pediatrics emergency clinic that she had established there, and to bring my daughter in. And she did some initial blood testing and came back and she said, your daughter either has leukemia or aplastic anemia. And in discussing that with her, said, well, what about aplastic anemia? She says, pray for leukemia, because it's much easier to treat in her case than it would be for aplastic anemia. As it turned out, she did have aplastic anemia. But in our case, it was one that we were going beyond what it would be typical for parents to do.
Yeah.
We'd already talked to the pediatrician. The pediatrician was doing what they would typically do. But because we saw something that concerned us, we went further. We went the next step. That can raise flags of the Munchausen by proxy.
Yeah.
Because a lot of times the doctors will question, okay, is there a reason behind some of this that, severe illness like aplastic anemia is not something you would typically look at in the early stages. But in her case, she may not have survived a few more days until we got the blood test back, had we not taken that case. So I'm not saying it's not right for parents to advocate for their child. But there's a recent case in the news. It's a Gypsy Rose, a girl who was mistreated by her mother, and her mother basically utilized her and took her into doctors and said that she had muscular dystrophy and that she had various mental defects and other issues related to her health. And part of that was to get sympathy for herself as the mother, but the other was also for the benefits that were available, being able to use some of the options for subsidies, payments. I mean, from what I understand, I think she actually got a house that was provided through these type funds. She got monthly payments for the child's care, some of the things like that, that really weren't necessary, but she saw that capability. In her case, and I've been trying to follow up more into this, but as they've gone back further into this, she falsified the medical records. She falsified the birth certificates. She moved from one doctor to another and didn't
So
necessarily
nobody
pass that
would
information,
get
so they could not
suspicious.
track this information. She moved from state to state, some other things like that. The other thing that came into play is that it is suspected that she may have been responsible for killing her own mother, and also there's pretty good case that she may have poisoned her stepmother. This is the mother in this case. So there were mental and psychological issues with this woman prior to her child, and she utilized that child as part of that psychological illness or that psychological issue that she
It was not
had,
control.
and folks were not able to realize that. Part of what I read is that there had been reports, to child welfare services and to the authorities, and they would go and talk to the mother, and she would show them the falsified documents or tell them the stories about some things that had happened or some other items, and it was just written off of, well, she's right, she knows what she's talking about. So there are points in times when you have to go beyond what someone is telling you and to get more information. But you've got to be cautious about going too far, because then you're impacting and dealing with the concerns of the parent being able to do what is right for their child.
Yeah.
But when I'm looking through this, the mother had said the daughter had muscular dystrophy. She had been tested in Louisiana, and the doctor in his reports had stated he did not find anything in the testing that said that she had that issue.
Yeah.
She went to Missouri, was telling that again. The doctor there tested and said he didn't find that either. The mother moved to a different doctor. Now, reading the analysis,
That's one of the issues, and I don't try to bring up things that are not relevant, but that's where you have the issue with addicts as well.
Yeah.
As drug addicts, they'll do what's called doctor shopping,
Yeah.
especially those that are addicted to pain pills.
Doctor shopping and pharmacy shopping and things like that. And a lot of that's more control. You've got tracking on those things.
Yeah.
Because they can track the prescriptions and the drug use and those things. The difficulty is there's not a central repository for medical records in most cases.
Yeah.
It does tie in some with insurance and insurance companies, health insurance companies, but more than anything,
but not all the insurance companies tie together.
They may not tie together, and the other is they're looking more for medical fraud, and they're not necessarily looking for issues like we're talking about in the health of a person that it may have not been properly documented in these things.
Yeah.
But as they're going back, doctors did note these. From what I've read, the doctor that was in Missouri basically brought up the question about that and was told, well, it's best to handle this with kid gloves, because this is a woman that had gotten a lot of notoriety for her daughter and her daughter's condition, and gotten a lot of perks related to that.
Mm-hmm.
And if the doctor brought that up, then he could be held accountable if he was wrong in that case. And since he was no longer the doctor, no longer had that child as a patient, it was better for him to just step away. So this is something that in the longer term we probably need to do something in our healthcare system and some of our legislation in how we do this, so that there's a better tracking mechanism on these things.
That, and there needs to be, so in psychology, which I'm not a psychologist myself, but I'm working on a degree and have researched what I've got to do to get licensed in Tennessee. So there is a state board for psychology, but everything else also falls under the American Psychiatric Association, which is an independent group that deals with approving and submitting licenses from the national level.
Yeah.
Basically, you have the state level in Tennessee, or whatever state you're in, and then you have a national level that reviews the state and says, yes, the state is correct, and sends it back to the state, and then back to you.
It is, and it's, I mean, a lot of these they're good concepts and good ideas on how we deal with these, but when you start talking about the sheer number of people and number of records that would need to be tied together and reviewed, in most cases we don't have the people, resources, or the capabilities to do that. So we sweep it under the rug, we ignore it until something like this comes up, and then it becomes an issue.
Why didn't the medical community do something?
Why isn't something done? So
and it actually hurts the medical community because it damages faith in the medical community as a whole, but also doctors and even nurse practitioners that are licensed, that they could either lose their job or they could basically not be believed and be reported to the state just for accusations of malpractice, accusations of wrongdoing.
So these are things, we're not necessarily giving answers on any of this. We're raising the questions. We're making sure that people are aware of some of these items and making it available for discussion so that people can think about these things and express their opinions and hopefully make some changes in the way we do things. So for that, I think we've ended another episode. Thank you very much for joining us for Mondays on Mondays, and have a great week.
Have a great week. See you next time.